It's Crystal. I'm here to talk to you about pseudocyesis and delusion of pregnancy. Now, a lot of people get the two mixed up. Pseudocyesis is also known as false pregnancy or phantom pregnancy, and that's where a non pregnant woman thinks that she is, by all means, pregnant. Symptoms include abdominal and breast enlargement, secretion of mucus, pigmentation changes. You also when it gets closer to labor, like your actual delivery date that you assume, you start feeling labor pains. Plus, you also get the movement of fetal development while the baby kicks inside the womb. And then there's delusion of pregnancy, which is very similar to it, but it's when the woman has a strong desire or wish to be pregnant, and despite evidence to the contrary, she still believes that she is pregnant. And these cases are actually more common in Saudi Arabia and other undeveloped countries rather than the United States. And if you can just look at the map right here on the phone, you can see that up here it's more controlled with a higher rate than actually in the United States itself. Okay. Now, for my class project, I actually focused on this case study, but let's see what Ramachandran has to actually say about pseudocyesis. And this is a direct quote. How does a highly specific wish or delusion originating in the neocortex get translated by the hypothalamus to induce prolactin production? And that is from chapter 11. And the answer to this is what some are calling hyperprolactemia. Now, what that basically is, it's your pituitary gland is creating more prolactin than the normal level. And you do see this in pregnancy right after births to help produce milk and other various hormones that are needed. And it usually goes back to normal after a few short months, or sometimes even sooner than that. With hyperprolactemia, you don't have it return right away, and this can often result in the delusion or feeling pregnant, which happened in 6 of the 12 women in the case study. They had the feeling of pregnant by their visceral gut sensations, along with some of the symptoms of fetal movement, and some went as far as labor pains. Now, each woman in the study had some form of schizophrenia or a schizoaffective disorder. There were a few of them that were in remission from bipolar disorder or a schizophrenic state. There was one woman, Mrs. L, that actually was still in a schizophrenic state while the rest were recovering, or at least not in a mania at this time of the case study. All women reported that they had hyperprolactemia after a bunch of tests, and then they gave them drugs to actually put their prolactins back to normal. And some other treatments that they have come across are cognitive behavioral therapies. Like, they have to get the patient to actually accept them being pregnant. So this goes for a few months with realizing, oh, wait a minute, no, there is no baby. And sometimes it doesn't often work. Another medical fact that you could associate with hyperprolactemia that's not drug induced is what's called a hyperprolactoma, which is actually a benign brain tumor. And I have one right here. Oh, sorry, it went away. Give me one. But it sits right up top of the optic nerve. As I Here it is, guys. As you can see, it's sitting right on top of the optic nerve. The red is the prolactoma, and this is from a CAT scan in May. And the optic nerve is the blue line right there. Now there are some other reports of hyperprolactoma being associated with pseudocyetis or the delusion of pregnancy. One I found very interesting was a UTI presented as pseudocyetis in a schizophrenic patient. And it was just a brief case report of the schizophrenic patient was 39 and had 20 years of being schizophrenic. And she presented with UTI symptoms, but she swore up and down that she was actually pregnant. She wanted to have a baby. They soon found out that it was pseudocyetis, and they treated her with drug therapy, and she became to realize that, oh no, it was just a false pregnancy scare or pseudocyetis. And that is pseudocyetis and delusion of pregnancy with hyperprolactemia.